get some feedback for my face. Okay. So, thank you guys for being here. And there may be some other folks joining as we get underway. So I'll kind of keep an eye out. And I guess, Megan, you can do the same to keep an eye out if anybody else hops on. But anyway, thanks for being here. I was just saying that it takes like a lot of internal motivation to join something that you aren't forced to join. I know we probably all have kind of like Zoom fatigue. So I appreciate you guys being here. We're going to talk about mental health in the time of COVID, and in particular, spend some time going over some tools for managing stress. And of course, any tools that you can use to manage stress now during a pandemic is going to apply beyond the pandemic as well, which hopefully we will move past soon. Before I really get going, I do want to just remind people that there's going to be at the end in the chat and also at the end of this presentation, a QR code that you can use to take a really short assessment, just like your impressions of this webinar. And people who fill that out are going to be entered to win a Elevate like I'm forgetting the words now, but anyway, like a kit that has a water bottle and t-shirt, and they have a cool logo. So I encourage you to stick around. Hopefully the content is engaging enough, but also you have the a prize that awaits you possibly. Also, I wanted to share, so there's 10 of us here. And if you guys would like to pipe up, ask questions, interrupt, that's totally fine. We'll have some time for questions at the end as well, but feel free to jump in. That'll make it more engaging for sure. All right. Okay. So you have, I'm sure, heard or seen on mugs or t-shirts this phrase, too blessed to be stressed. And during the pandemic, having kids or not having kids, living with a partner or not living with a partner, whatever your situation is, of course, there are things to be thankful for, right? Like we're here right now, which means we're not in a hospital or whatever. Like we have a lot of things a lot of blessings in our life. But that does not mean that we can't also be stressed. So sometimes my house looks like this, but many times, perhaps even more often, it looks more like this. So I would imagine if this is true of me, it's probably true of you too, that you during this unusual, difficult year have experienced like blessings or things that you're thankful for. And that does not negate the fact that you are under a lot of stress. So let's talk about that a little bit. We're going to talk today about what is stress. What are we talking about here? And what are some pandemic related sources of stress? And of course, there's other sources of stress as well that just pile on top of these kind of novel things we're facing right now. We're going to talk a little bit about how does stress affect our minds and our bodies, and then what are some practical strategies for managing stress. So hopefully we have time to spend the bulk of our time on that last point there. All righty. Okay, so what is stress? Stress, when we say that, at least in the context of what I'm talking about tonight, is pretty much referring to the body's response to any demands, okay? And not all stress is bad, right? So let me move this out of the way here. This is like a inverted U or whatever. You may have seen this in classes or whatever, and you probably know it to be true. So if we have, basically there's like an optimal level of stress or pressure, and that is associated with like peak performance. Like we want to be like a little stressed, a little nervous or whatever, because we know that kind of like motivates us to do our best, right? Like when you're going to meet your future in-laws, you have like a little bit of stress there. So, and that motivates you maybe to be on your best behavior or whatever, make a good impression. However, when stress increases past a certain point, our performance starts to go down, and performance could mean anything, right? Like performance at school or just functioning in life. It starts to go down, and that's referred to as distress. And this is really what I'm going to be talking about today, experiencing levels of stress that are not motivating, that are not helpful, and that result in decreases in performance and also like some unpleasant emotions here. Okay, so stress is the body's response to any demands. That's pretty vague. And I just wanted to, since we have a group here, it'd be more interesting, I think, if we were able to chime in. What are there any additional demands maybe that you have faced in the last, I say few months, it's actually like many months, in the last like 8 months, that have added stress, pushed your level of stress up a little bit? And you can just like unmute yourself and pipe up, or you can use the chat box if you'd prefer.
There's been watching out for like people in your household who are ill. That's a new vigilance. That's the best I can put it. That's a new demand.
Mm-hmm. Mm-hmm. Yeah.
Been a little paranoid.
Yeah, right. Like a whole new thing to feel, a whole new set of worries that who would have thought like disinfecting groceries, for example, could be something that would like elevate our distress. Elevate our stress. Yeah. And looking out for coughs and what does that mean? Temperature. Exactly. Yeah. Anything else you can think of?
Dr. Ratcliff, I have a funny one. All of these new technologies that we are using, which clearly like to fail on us. So I apologize, everyone. I'm Megan. I am one of the co-hosts for tonight's presentation, and my audio went completely out right when it was time for me to introduce Dr. Ratcliff. So perfect timing for the additional demands for me, learning technology and learning how to roll with the punches when they're thrown at us. Has been one of my additional demands.
Yeah, great example. Great example. Yeah, do we want to say one other one that maybe folks can think of?
I say definitely for the parents, just the simple fact of having to do this virtual learning thing and then having like a communication with the teachers, that's stressful. And, having a 4-year-old, you got to tend to, which a lot of people are going through.
Mm-hmm, mm-hmm. Oh my gosh, it's like it's insane. It's insane. Someone said the other day, like no other generation has had to do this because we didn't have virtual learning, obviously, like in the 19 or whatever, the other pandemic and Spanish flu. So it just saying that almost like brought tears to my eyes, because it was like, oh yeah, like this is crazy that we're having to do all of this stuff. But the list could go on and on. Okay, I'm going to make this smaller. The list could go on and on. So those are, you guys hit the ones that I was thinking of. So the worries about actually getting infected or your family getting infected. And oh my gosh, the holidays are coming up, and the number of conversations that I know must be happening across the country right now, across the world, about, who are we going to see? How are we going to see each other, et cetera, is extremely stressful. We've also had the added stress of trying to teach or work or learn from home. And just like you mentioned, Megan, there's technology challenges, there's focus challenges, there is, you're not getting out into the world. And so that can have a big effect on attention and mental health, as we'll talk about in a moment. Like you said, working from home and or learning from home, and then having kids learning from home, or in my case, sometimes not learning from home, just being at home, wreaking havoc. That is super stressful. And then working from home, of course, is a luxury, right? A lot of people are not able to work from home and are facing the virus and threats of that in their work life, or they are unemployed. So also there's financial strain associated with a big spike in unemployment. And then, of course, the social distancing that we are encouraged to do, and of course is the right thing to do, results in some increases in loneliness for folks. So this was a study looking at changes in loneliness in April compared to the prior month. You can see here, so the light blue and the dark blue are the percent of participants who reported being a lot more or a little more lonely than they were the prior month. And you can especially see for that like 18 to 24 bracket quite high, and also for the 25 to 34 bracket pretty high in terms of an increase in self-reported loneliness. Okay, here we go. I'll leave that to you guys to review. So there have been so many demands placed on all of us, and stress has certainly increased over the last few months. And in fact, this was put out by the CDC, a survey of adults in the United States in the month of June, 40%. So that's getting close to half of US adults reported struggling with mental health or substance use problems during that month, which is much higher than the point prevalence. But more like normally when we look at a slice of a month in time, it's more like about 12, maybe 25 at most % of folks experiencing mental health or substance use symptoms like at that exact moment. So you can see here some of the more common things. 1 in 3 people reported problematic anxiety and depression symptoms. Over a quarter of people reported problematic PTSD related symptoms. And some of that is before, when life was more normal, we were busy, we were doing things. And so now sometimes mental health symptoms that might've been lurking in the background that we could distract from are coming up to the forefront. Started or increased substance use among 13%, and then seriously considered suicide 11%, which also is higher than is typical. And rates of suicide have also gone up. So it's been difficult. Obviously, it has been very difficult on folks, and that stress level has just been going up, and the distress has gone up right there with it. So there's certainly been some serious mental health consequences of this pandemic. And before I go on, anytime I'm talking about these kind of mental health problems, such as symptoms of anxiety, depression, or thoughts of hurting yourself or taking your life, I always want to mention, so we're going to talk about some coping strategies today, and everyone can use coping strategies, right? Like, I mean, that's just like part of navigating really any time, but especially a time like this. But sometimes professional support is the right thing, is the right move, right? Is necessary. And so I just want to put a little shout out that there are things beyond coping strategies available to you. So anxiety, depression, PTSD, and other things too. I mean, those are just some of the more common things people experience. But these are all very responsive to appropriate mental health care, and particularly to like talk therapy, or in some cases medication as well, and like in combo. So mental health resources are available to students and also to staff and faculty, actually. And they can be found on campus at SAM in particular. So the counseling center at SAM has, I think it's 10, free, I mean, they're free, you're paying for them in your fees, sessions available to students. And they are doing telehealth. Okay, so you can just call the phone number, visit their website, call the phone number, and you'll get a telehealth appointment. So you don't have to come in. And there is not, I feel like I remember seeing that there's not a wait list. You can just call and talk to someone. Also, though, for staff and faculty, we do have the Psychological Services Center, which is offered on a sliding scale, and it's right there on campus. And we're also offering, I'm a supervisor there, we're also offering telehealth right now. We're not seeing anybody in person at this moment. So there's resources available, and I also always want to share the Suicide Prevention Lifeline. So 1-800-273-TALK, and you can also text, and you can also chat online with folks at any time if you're having thoughts of hurting yourself or any kind of worrisome thoughts, troubling thoughts in that vein. So I just want to put that information up there. Oh, that's right. Thank you, Erica. Yeah, we also have yeah, that's a really good point. We also have EAP stuff, so for staff and faculty. And I don't honestly, so I would have to look that up to provide you with resources. I should have put that in here. But I think if you Google it, you could probably find it. Or maybe, I don't know, Erica, if you have a link to how we should go about accessing those kinds of resources. I do just want to make this point that we're talking in here tonight about coping strategies, which is great. But I don't want you to feel like, oh, like that's it. You know what I mean? Like this isn't really going to get me through what I'm experiencing. And if that's the case, then you are not alone. There are so many people right now who are accessing mental health services for the first time. So I just want to put these out there and kind of raise awareness about that. Okay, so I just want to make this known. Okay, thanks, Erica. On the Human Resources website, there's free counseling sessions also for faculty and staff. Wow. Okay, great. I can't believe I didn't haven't been like shouting that from the mountaintops, but yes. Okay, cool. That's available to us as well. Okay, so let's talk now just a little bit about physical health consequences of pandemic-related stress, or actually just any stress. So unfortunately, our bodies pretty much do the same thing in response to stress, no matter what the source of stress is. And so that same thing is things like activating your sympathetic nervous system. So that means like that, pretty much like what we're talking about is like the fight or flight system. So this means your pupils dilate, your muscles get tense, ready to run away from danger. Your digestive system kind of like stops working basically because you don't really need to process your food if you're like running away from something. And a whole host, your breathing speeds up. Your cheeks may flush because your blood is coming to the surface because like ready to go. A whole host of other kind of like downstream effects to ready your body to respond to stress. So this is very helpful in certain situations, right? So if we're being chased by a bear, or if we are running away from some sort of like physical threat of danger, that's great. Our bodies are like designed to get out of there and help us stay alive. And where we just like our body keeps going so we can kind of keep running, right? Run up the tree or do whatever we need to do to stay alive. Unfortunately, most of the stressors that we experience today are not helped by this. So our body like really ramping up to protect us from danger through things like having our muscles tense and like ready to run makes no sense. If it really doesn't help when we are staying vigilant, like you said, about the symptoms of COVID, or when we are struggling to try to find a job, or when we're trying to pay the bills, or when we're trying to manage kids in the house and their virtual learning, and all of the virtual disasters that can occur, right? So it's like kind of a mismatch, which is very unfortunate. The other thing is like these stressors that we talked about, now that this pandemic has gone on so long, we know these are chronic. These have now become chronic stressors. It's not just like we had a really tough day or something like that. This is like every day for months. And so that stress on our bodies seriously takes a toll, right? Our bodies are like responding to this stress in this as if we were running from a bear, but it's like we're being chased by a bear for months, right? And so that can take a serious toll on our bodies. So in fact, every time I talk about the effects of stress, I usually talk about this study done in mice. And I was like kind of chuckling because it's like weirdly similar to what we've all been put through in this pandemic. Okay, so here's what they did to the mice. This is just like illustrating the effect, the toll of stress on the body. They put mice in these little well, first, before they put them in the cages, this was a study done at MD Anderson Cancer Center, actually in Houston, and they injected the mice with ovarian cancer cells. And then they put the mice in these little like cages or whatever. And for some of the mice, they squished them, okay, and put them in a very tight, confined environment, which is like an animal model of stress. It doesn't, well, maybe it hurts the mice, I'm not sure, but it's not supposed to hurt them. It's more supposed to stress them. They're like, how do I get out of here? So for some animals, they didn't squish them or stress them. For some, they did it for 2 hours a day, and for some, they did it for 6 hours a day. And they did that for 21 days. And then at the end of the 21-day period, they looked to see what had happened with those cancer cells. Did they grow, basically? Did they spread through the body? And they found a big effect of that stress. So in the control condition is here in these smaller bars. And so here you can see that stress, the 2 hours a day of being squished or stressed, and the 6 hours a day led to much heavier tumors, much larger tumors, and many more tumor nodules. So basically this is illustrating in an animal model, the effect of stress on our body's ability to fight off things like cancer, meaning that stress has a very real effect on our well-being and our physical health included. Interestingly, they did this exact same study in terms of injecting the mice with the ovarian cancer cells. But the stressor, instead of being squished, was being isolated. So mice are social, just like we are. They live in communities. So they had mice that they isolated for I think it was like a 21-day period, living in, I mean, they had food, water, they were just by themselves. And then they had mice that lived in their normal communities. And the same thing happened, that the isolated mice had much heavier tumors and many more nodules, which is, again, just highlighting the really serious toll that stress can take on our body's ability to function. So let's check the time here. All right. There are many, stress is unavoidable in any time, and it's especially now, right? It's unavoidable. There are things like kids are going to be virtual learning for some of the time. We're going to have insufficient childcare coverage, et cetera. The list goes on. But there are some ways to respond to it. And I'm going to talk about each of these briefly, and a few of these we're going to practice together here. So we're going to talk about social connection, mindfulness, gratitude, getting active in terms of doing things that matter to you, and then getting some sleep. Sleep problems have been on the rise over the last few months. All right, so first of all, increasing social connection during a time of social distance. Okay, whoopsies. Here we go. So I was doing some research on this, and this is supported by science. So live interactions that are virtual, things like FaceTime, Zoom, even like the telephone, or even like an interactive video game, increase a sense of connection and do carry a lot of those benefits that face-to-face interaction has. Of course, a lot of us would prefer face-to-face interaction, but if that's not possible, this is basically better than nothing. I do want to make a note that the same body of research suggests that passive social media, such as like scrolling through Instagram or Facebook or whatever, that actually seems to do more harm than good. Okay, so if you also think about this kind of like in an evolutionary standpoint, it makes sense, right? Like we weren't really designed to passively look at each other's lives, right? We were designed to be social and to interact. So that's not so helpful in terms of our mental health and our sense of connection to one another. So if you notice yourself feeling lonely, and again, lonely is not the same thing as being isolated. Like you can be isolated by yourself and not feel lonely, or you can be in a big crowd of people and still feel lonely, right? So lonely is like that, your own perception of not having enough social connectedness. Anyway, if you're having that feeling, think about scheduling a virtual hangout. I mean, it's better than nothing. I don't want this to sound overly trite, but I do just want to mention that this helps, right? Sometimes it can just push you over the edge to do something if you know that it can actually be helpful. Okay, so the next thing I wanted to talk about is mindfulness. And this is one of my very favorite things to talk about. How many of you, I wish I could lamenting not being able to see you. How many, who has heard of mindfulness? Okay, I don't want to ask that question because it's like, people are going to be like, yes. All right, I'm just going to go ahead. Okay, and I'll stop. We'll talk about it in just a minute. Okay, so mindfulness means is all about bringing your attention to the here and now. You know what? I'm gonna ask because I want to know what's going on with folks. How many of you guys have heard of mindfulness and have practiced it, like using one of these popular apps like Calm or Insight Timer, Headspace, something like that? You can put it in the chat, or you can unmute to say. Has anybody practiced mindfulness in their regular life?
I have a meditation corner that I try to use occasionally.
Okay, like a meditation corner in your house?
Yeah, in my house with like a pillow and like little crystals and stuff.
Yeah, awesome. That's perfect. And then a couple of people mentioning having used Headspace before. Anybody else? It's just helpful to get a sense of that. If everyone's practicing mindfulness on the regular, then I'm like, no, it's a little bit of a different audience. But anyway, okay, so mindfulness, for those of you who may not be familiar with that particular word, is all about bringing your awareness to the here and now, to literally right here in this moment, like right now. with a sense of openness and curiosity, kind of like you're a curious scientist or a little baby who's like never seen a toothbrush before, whatever, like never encountered these sights, smells, whatever before. The way that I have described let me move this so you can see this little cartoon here. The way that I've described mindfulness before is that I feel often like my mind is like sucked up into a tornado, right? Like I'm driving somewhere and I arrive and I'm like, I have no idea how I got there, like no memory of that drive, because my awareness was not here driving. My awareness was in this thought tornado. And my thought tornado was thinking about the future or the past. What am I going to put on my grocery list? Like, was that a weird conversation I had last night with my brother or whatever? Not here, up here, about the future or the past. Mindfulness is all about purposefully pulling yourself out of that tornado and getting yourself into your body right here, right now. And the best way to do that is by using your senses, because you can't see or taste or touch or hear something that isn't right here. Our senses are good ways of anchoring us to this present moment when our thoughts just want to flutter up into this crazy tornado. So basically that's what mindfulness is. And the coolest part about mindfulness to me is that being aware of the here and now reduces distress, improves creativity, improves mood, improves social connection, even when the here and now is terrible. I think it's so amazing. So they've done mindfulness studies on people who are, for example, like having their burn wounds changed. And they had people to just be here now and notice what's going on, like not like try to like distract themselves or whatever from the experience of having their burn wound changed. And they compared those folks to people who were trying not to think about it, basically. And the people who were just being mindful of that experience had less distress related to their pain and actually reported less pain than the people who were trying really hard not to think about it. And I just think that's awesome. It's like life can be so rich when we show up for it, even when it's crappy, like even when we're in the middle of something terrible. It's like it's better to be there for it than to try really hard to not be here for it, if that makes sense. So mindfulness can mean you can have like a formal mindfulness practice where you like listen to like a guided mindfulness meditation where you're sitting in a calm space or whatever and like kind of thinking, purposefully bringing your thoughts to the here and now. Or it can be something more informal, like just bringing your full attention to a daily task with a sense of curiosity and openness. So things like brushing your teeth or washing dishes or bathing or eating, like any basic thing like that, you can choose to really try to really turn your attention to it, turn on your full senses, be like this dog, right? Who's just there for it, just for that moment. And instead of how we normally are, which is this guy, he's like in a lovely spot and he's like thoughts crammed with other things. So let us try it. So I was just going to guide you guys through a brief mindfulness exercise together. And I'm going to talk you through a mindfulness of the breath exercise. It's kind of like a basic one. And I put this question in here because I always ask it. I'm always like wanting to remind myself, like, what is the point of this? Like, why am I doing this? Why am I trying to like pay attention to my breath? How is that helping my life? You know, like I have a million things on my plate. I'm trying to manage all this stuff. It's basically chaos at my house. And I'm like trying to like pay attention to how my nostrils feel when my air is going in, like why? And the reason for that is basically developing that skill of being able to turn your attention towards the here and now. And I mean, the breath is just like an anchor for this moment. It doesn't have to be the breath. It could be, you know, feeling something in your hand or eating an ice, whatever, something that you can draw your attention to your senses, can pull yourself just for a moment out of that thought tornado and get yourself here now where life is happening. I think about this a lot when I'm actually brushing my daughter's teeth. She's 4, so she like does it herself, and then I go back in and help her. And I'm like down there looking at her little mouth, and it's an opportunity because there's a lot of senses involved, right? Like toothpaste and um, holding the toothbrush and everything. It's an opportunity for me to just stop and like be here, be here right now, and like really get it that this is happening, and appreciate this moment, honestly, like be really aware of this moment that we're sharing like face to face so close. So anyway, that's kind of like an informal mindfulness thing that I notice myself doing often. Whereas, my mind wants to go to, okay, what are we doing next? Have we done PJs? Have we finished like brushing hair? Like whatever. An anchor in this moment. So it doesn't have to be your breath. That's what I'm saying. Okay, so let's practice just being here now. So if you would, you can just get yourself into a comfortable position. And usually that means your feet on the floor and your posture sitting upright, attentive but relaxed. You can close your eyes or just rest them softly somewhere in front of you. And just take a moment to settle into this moment. You're coming from a full day. You may have many things left to do before your day is done, but for right now, you're just right here in this moment. Notice how your body is sitting in your chair. Notice the floor supporting your feet. The chair supporting your legs or your back. And as you go on, you might start to notice your mind wandering off into the future or the past, getting hooked on some interesting thought or story. And as soon as you notice this, just gently bring your attention back to this moment right now. And you can use your breath as an anchor in this moment. So let's go ahead and turn our attention to our breath. Notice what it feels like to inhale and exhale. Notice it like a curious scientist might, like you've never felt those sensations before. You don't need to change your breathing in any way. Just notice what's going on. Notice how the breath basically breathes itself. And see if you can find the one aspect of each of your breath that is the most salient, where you can feel your breath the clearest. Maybe it's when the cool air rushes in through your nostrils, hits the back of your throat. Maybe it's as your abdomen rises and falls. Just see if you can keep your attention there, at the place where you feel your breath the most clearly. And again, as your mind wanders off over and over, just gently bring it back to this moment. And now let's take one last mindful breath together. Really relishing every part of that breath. And you can expand your awareness back out to the rest of your body as it's seated in your chair. And expand your awareness out even further to the room that you're in, to the screen that you're looking at. And then give yourself a nice stretch. And we can talk for a minute about how that was. So that was just about a little over, just about 5 minutes, I think. I didn't quite time it, but I wanted to check in with you guys about how that felt. And I don't know what your impressions were of it. If it was hard or familiar, anything you've done before in the past. Oh yeah, you can unmute or put in the chat. Or if you've walked away.
I know for myself, Dr. Ratcliff, I enjoy doing those types of exercises because it's very easy during the chaos of our days when we get so bogged down with work or school or our personal life, just all the many hats that we're wearing. It's really good to do these types of exercises to recenter ourselves, to ground ourselves, and kind of just bring that focus back into the current moment that we're in.
Mm-hmm. Mm-hmm. Yeah, exactly.
It looks like we have a question in the chat. Why is it so hard to commit to doing those mindful things consistently?
Yes, I feel the same way. And I agree too. It is, I have my own little mindfulness practice that I have, to be honest, I have not kept up as much as I should, especially during this crazy time. It is hard to do it consistently. So we're actually going to talk about setting goals. If this is something that you want to try, to kind of like make it a priority for yourself, basically set a specific time and whatnot. So I'll present some stuff about like setting goals related to this in just a minute, because you're right. I mean, this feels good right now. It feels very good to give your mind a rest from that tornado. But it is hard to do it, hard to get yourself out of that tornado. So one thing that I think helps me a lot is oh, good. I'm glad that this is being done in some classes as well. That's great. One thing that helps me a lot is having a guide, right? So just sitting silently with nothing is hard for me to do at this point. So these are some of the apps. I'm actually pretty partial to Insight Timer because there's tons that it's all free. The other ones, there's like a paid version and they're kind of expensive, especially Calm is, I feel a little bit expensive, but a lot of people like it. So anyway, check these out. If you don't have them on your phone already, check them out and see what you think. There's more than just this, but these are some of the ones I've tried and have liked. Okay, so in our last few minutes together, I do want to save some time at the end just for if you have any questions or whatnot, but hopefully. I did also want to talk about a few other things, and one of them is cultivating gratitude. I have just been really into this notion during this pandemic and of purposefully practicing gratitude. And I think the reason for that is, for me, and it sounds like for some of you guys, the biggest source of my stress is also the biggest source, is also the thing that I am the most grateful for. And that is my children. So practicing gratitude has been very helpful for me to to look at the full picture of this rich life that I have, and that I know that is represented here in each of you guys, this full and rich life that also is got so many things to be stressed about, but we often zero in on the stressors. I said in another, when I was talking about kind of stress management strategies in another context, that At the dinner table, I'm often noticed myself often saying like what had gone wrong that day or like something annoying about that day. But we started to try to do this summer to say something we were grateful for at the dinner table. Kind of to steer the conversation in a different direction. And it has really helped. It's like changed the whole attitude of the way we talk as a family, and the kinds of things we bring to each other, like as a couple. So yeah, that's just been really helpful for me. Research supports it. So I'm not going to spend a ton of time talking about this research. It just in the interest of time, I guess you can say like, take my word for it. I read all about it, and you can too. This is research done by Seligman, but others have replicated it, which is people who wrote down a daily gratitude list, like 3 things they're thankful for each day, for just 2 weeks, reported increased happiness and decreased depression. Get this, 6 months later. They literally did it for 2 weeks. And then 6 months later, they're still reporting greater happiness and lower depression compared to the placebo group. I mean, I think the placebo group wrote about their early childhood experiences. And then another set of studies had folks write and deliver a gratitude letter to someone that they were grateful for in their life. And same type of deal. They had increased happiness and decreased depression a whole month later. This was like one letter they wrote, delivered it a whole month later. They're seeing the effects of this. I think this is awesome. I mean, gratitude interventions, like practicing gratitude, I mean to say, makes like intuitive sense. It's kind of fun to do. And the effects are like weirdly long lasting. They are really impressive to me. So basically, gratitude is simple but powerful. So I encourage you to try to think about if you want to do this, practice gratitude each day, even for small things. This is a free app. Well, I actually just realized I ran into my free things. So it's like free for 30 days, but anyways, 30 entries. But I do like it, and I don't think it's that expensive. So I would encourage you to think today about think now about what you're grateful for today. So I'm going to stop talking for a minute just so you can maybe write down one thing. I won't force you to share over Zoom because I know it can be a bit weird, but I'll just stop talking. You can, I do encourage you to like find an actual pen though, and seriously write down like one thing that you're thankful for today. Okay. You can add to that later if you want. Although interestingly, research suggests that going crazy and like journaling about what you're grateful for like 20 minutes is actually not helpful. So keeping it short is best according to the research on this. And then I also wanted to ask, who might you write a letter of gratitude to? Not that we have time to write a gratitude letter right now, but just to kind of like get you thinking if you want to carry this out. It's not that hard. It would mean a lot to somebody else, and it has seems to have positive effects for like a whole month. So I'll stop talking now again and let you think who you might want to write. And again, I encourage you to use a pen and like really write down someone's name of who you might want to write a gratitude letter to. All right. All right. Okay, so another very helpful tool, there's tons of research to support this as being effective, is called behavioral activation, like in the research, but basically this means like getting active by doing things that matter to you. So inactivity, I don't know about you, but this pandemic has resulted in a lot more inactivity. I mean, I'm moving around, you know, it feels like my life is more chaotic and also less active at the same time. Great combo. So inactivity, meaning like, you know, not moving around physically, but but it also could mean like not, you know, calling friends or making meals or whatever it is not good for us, right? So when we have a low mood, we tend to have low energy. This is the cycle here. And then when we have low energy, low mood, we're like, blah, we tend to avoid pleasant activities and people. And that can lead to isolation or just kind of like a continued blah feeling, worse mood, and on and on and on. It's like kind of like negative spiral. I think of this like we recently tried to make one night a week sounds like embarrassing to admit, one night a week, a TV free night, because it's so easy to just like plop on the couch. Maybe you get your kids to bed, you like plop on the couch and you're like, turn your brain off for a little while, which is fine. I mean, that's okay. I'm doing that, plenty still. But picking one night a week where we don't do that, it's given us a chance to do other things. So like, we like, maybe this isn't so helpful, but anyways, like make a little cocktail night. We can't go on dates anymore as a couple or whatever. Like, so we're sitting in our backyard, but it feels so different than sitting again in front of the TV again. And we sometimes want to sit in front of the TV on the no TV night because it's nice to turn your brain off, right? But setting a goal to do something that matters, in this case, like spend time with one another and talk about life, how your day was, whatever, does a huge favor in terms of mood. And that's just one example. There's lots of other things we could do, gardening, what have you. Let me see what's going on here. Yeah. So give it a try. If you feel like you don't have time, there's a weirdly ton of time after, like in that evening time, often when we're just like feel too tired to do something. It can feel good to do even, something small. So hopefully that made sense. Just basically like picking something that you find to be pleasant or meaningful, and pretty much like forcing yourself to do it because we're all so tired. We're pulled so many different directions. Forcing yourself to, even if it's just like take a bath, that's like takes more effort than taking a shower, I think. So, but if you like it, kind of putting that as a goal and forcing yourself to do it can do a lot to improve mood. Okay. So last but not least, I'm going to talk about this very quickly, is getting a good night's sleep. This is the percent of people reporting clinically meaningful sleep difficulties. This was reported, I think, in Nature, or maybe JAMA, probably JAMA. That makes more sense. Anyways, the percent of people reporting sleep difficulties before the pandemic here in the blue, and then during the pandemic, it has shot up quite a bit. So it's like, I think it's like 30% pre-pandemic, and it's about 50% now, which is half the people. Half of all people are now reporting having sleep problems. That's a lot of people not sleeping. That means probably a lot of the people on this call are in that orange bar, not sleeping very well. It's hard for me to tell because we had a baby right when the pandemic started. So like, I'm definitely having sleep problems, but I don't think it's necessarily the pandemic. But anyway, so there are some pretty simple, like I'm going to call them rules, whatever. I feel like they are rules. I'm just going to say, or guidelines, but I don't think they're not really guidelines. They're more like you really should do them for getting a good night's sleep. And here they are. I'm going to present them here to you now. Establishing a regular sleeping schedule. So that means going to sleep and waking up at the same time every night. That can be really hard if we're working from home and our work is like bleeding into our room and our bed, and our schedules are just not as strict as they were when we had other places to go, basically. So this is really important. This is a big one. Limiting the bed for sleep and intimacy. Not anything else, literally nothing else. So that means this, which is what we are all doing probably in a few hours, is a no. Don't do that. If you're having trouble with sleep, make your bed a no phone zone, at least for you. If you have another person in your bed, you can't control them. But for you, you can control not having a phone in your face right before you try to go to sleep. That can do a huge amount to improve sleep. And this is coming from the research, not just me. Get out of bed if you're not asleep in 15 to 20 minutes. The idea here is that you want your body and your mind to associate your bed with sleep, not with not sleeping. So what happens when we are on our phone, or when we're working in our bed, or when we're tossing and turning and just like trying to force ourselves to go to sleep, is our mind is like, oh, bed's the place where I do all these other things and where I don't sleep. So you want to unpair that, right? You only want to pair bed, sleep, bed, sleep. So if you're in your bed not sleeping, get out of there within 15 or 20 minutes. Make your bed and bedroom as conducive to sleep as possible, which means like keep it cool and dark. So like blackout curtains, things like that can actually do a lot to help. Try to relax before bedtime, or if you do have to get out of the bed at night because you're having trouble staying asleep, try to do something relaxing. So that could be like reading a book that's not that engaging, honestly, taking a bath or something like that. Do not get, again, repeat, do not get in your bed at all during the day. So especially during this time of being at home all the time, working in bed or taking calls in your bed or whatever, it's very tempting. This is not a good idea. Again, we're pairing sleep only. Sleep is a behavior, right? So you're learning this behavior pairing. Avoiding caffeine, tobacco, and alcohol within the 6 hours before bed is ideal. A lot of alcohol can interfere with your sleep. It might make you feel like you have a better time going to sleep, but you get much less restful sleep with alcohol in your system. And then exercise at least 3 or 4 days per week, but try to avoid doing this within 4 hours of bedtime. And then try spending a few minutes each morning in natural sunlight. So just like walk out onto your outside if you can, or open a window and be near the sunlight if you can. Oh yeah, okay, a white noise machine is also a good idea for like cool, dark, and quiet. That's another good point here. Okay, so in conclusion, cool, we've got like 5 minutes left. In conclusion, I just threw a lot of stuff at you. So this is kind of like a recap. And I'd like for you to choose one thing that we just talked about that you would like to try this week. So maybe something in the domain of increasing your social connection, practicing mindfulness, giving thanks, doing something that brings you a sense of joy or meaning. For example, like not watching TV and doing something else, maybe more meaningful, or putting these rules of sleep into practice, getting some sleep. So I'd like for you to write it down, like really make a choice. I mean, I can't like monitor you, I guess, but I would encourage you to really do this. Get your pen out and make a choice about which domain, like which colored thing you want to try this week. And then on the next slide, I'm gonna kind of like walk you through setting a goal for carrying that out this week. Something more specific. Okay, so I'm gonna stop talking for just a moment so you can pick your thing, what you think would fit best with you. Okay, so now that you hopefully have your like the domain or like the skill that you want to try out, let's try to set a goal together to manage stress a little bit better this week. So it's best to set a SMART goal. So have you guys heard of SMART goals before? You can like say yes or say unmute, whatever. Is this a familiar term?
The term's familiar, but I haven't had one before.
Okay, cool. Maybe some level of familiarity with it. So SMART stands for specific, measurable, achievable, relevant, and timed. So when you're trying to, all of the things we just talked about, I'm not going to relist them, but all the things we just talked about sound great, right? We're in here like, oh yeah, why don't I do that more often? Like, that's a great idea. Well, we don't do it more often because it's really hard to change our behavior. It's really hard. We're like on a train track and it's like hard to veer off and do anything different. And so setting a SMART goal makes us more likely to actually put something into action. First, it's important to be really specific. So state what you're going to do. So for example, I'm going to just say my SMART goal now. I'm going to like make it as we're talking. So my SMART goal is to practice, use my app Insight Timer 2 times, pretty lofty. I'm going to practice using my app Insight Timer 2 times in the next week to practice mindfulness for like each of those times are going to be 5 minutes long. Okay, so that is measurable. I'm going to know if I did it or I didn't do it because it's 2 times each 5 minutes. Like you can tell, oh, I only did 1 or I did 0. I think it's achievable for me in the next week. Oh yeah, let me add to this specific thing. It's good if I pick the specific time that I'm going to do it. So I'm going to say at 8 p.m. because usually everyone's asleep and I can choose what I want to do at 8 p.m. And I'm not so tired that I can possibly do it. 2 nights this week. Okay, so anyway, I think that's achievable and it's relevant. It makes sense. I don't know why it says within your job function. That's not quite what I mean. It makes sense for my life and my own goals. And it's time bound. I'm not saying I'm going to do this every 2 times per week for every week for the rest of my life, just until next Wednesday, right? That's it. And then I can evaluate, how did that go? Do I want to re-up, or do I want to do something different? Does that make sense? So I guess, again, I'm going to stop talking and let you guys, I would like for you to write down a really specific goal about what specifically you want to try to do this week, and make it time bound, and make it to where you can like tell if you did it or not. So like a goal such as practice more mindfulness would not be a SMART goal, because it's like, what's more? Like, how would you know if you did that? So I'm gonna actually navigate back. Oops, hold on a minute. Navigate back to here, just to remind you what the things are. So again, I'll stop talking. Just it's a specific goal that is time limited, that relates to one of these things that you want to give a try this week. Okay. All right, that was quick, but hopefully it gets the creative juices flowing for what you want to do. So in our last 1 minute, I want to, yes, here we go. Thanks for being here. I wanted to share, there's a QR code that will take you to the survey, or Megan just put the link to the survey in the chat. If you fill that survey out, you're entered to win a Elevate prize pack, which includes water bottle and a t-shirt. I will stop myself there and just open it up if you guys have any questions or comments. I know we don't have too much time left, but feel free to share any of your thoughts or questions now.
Dr. Ratcliff, we did have one question come through the chat. What signs and symptoms of stress am I looking for? I know I've heard of loss of hair, but what else? I have a bad habit of denying I'm stressed at all, and I just try to keep pushing through the day, one day at a time. So are there any specific signs of stress?
Yeah, that's a really good question. So in general, yeah, so like thinking about like when to seek professional help, when it's like beyond just sort of like daily stressors that we can maybe manage with some of these coping skills. You really, what we're looking for are two things, and they're kind of subjective, but one of them is like level of distress. So kind of gauge your own level of distress, right? Like if you feel like my life is kind of chaotic, more chaotic than usual right now, I have a lot of stressors on my plate, but like ultimately I'm okay. Like I'm actually feeling okay at the end of each day. If that's not the case, and you're more feeling like I cannot do this, like I'm not well, I'm not doing well, and we've all been there. So one is looking at your level of distress, and then two is looking at your like the impact it's having on your functioning. So if your mental health symptoms, like if your stress and distress is causing you to have a hard time completing things, or showing up for things, or eating appropriate meals, or whatever, like however you want to define functioning. But if you're feeling limited, like in terms of functioning, that would be another sign it's a good idea to reach out for professional help. I mean, it's always, I think, good to err on the side of caution, particularly since as students, faculty, and staff, we all have access to some counseling resources. And yeah. Any other questions or comments that you guys have?
Well, on behalf of, oh wait, one more. I try to make dinner time a no phone zone. I think that's a great option, Kimberly. So you can set aside all distractions. Very good. If there are no more questions from the group, I do want to thank all of you all on behalf of Elevate for attending our webinar today. Special thank you, of course, to Dr. Ratcliff. All of the information that you provided us was very beneficial. I know I need to put into motion some of those sleep tips for myself, so I will be making my SMART goal right when I get off of this. Please do complete the survey. We have the QR code right here on the screen. You can scan your phone over it, or you can click the link that is in the chat. So if there is nothing else, thank you all again for attending, and we hope to see you at another Elevate event soon.